Some wasted medicines are unavoidable. For example, if a patient takes a medicine which doesn't suit them, or if the treatment is changed for whatever reason. At least £300 million of medicines are wasted in the NHS every year, so it is quite a significant financial problem. Sometimes it's down to simple things like misunderstanding what the treatment's for, not perhaps understanding the implications of not taking the medication, or they could simply be confused. Perhaps the most important thing is that if medicines aren't taken correctly or not taken at all, then people are at much higher risk of suffering ill health and in the worst cases possibly even having to go to hospital unnecessarily. There seems to be some evidence that patients don't understand what their medicines are for and perhaps are not as well informed as we would like. The patient information leaflets which all patients receive with a medication can sometimes be difficult to understand. Perhaps people decide they don't want to read them for whatever reason.
About half the time. I certainly don't read all of the fine print when I get my medicine.
I guess I've only checked it once and assumed it was the same thereafter.
They just decide to take them willy-nilly.
If you have this, take this dose. If you have this, take that dose.
They're printed so small that at my age you just can't read them.
I just don't even pay attention. I just take them when I want them.
What suits one patient doesn't necessarily suit another. What we're really aiming to do is tailor the information we give to patients about the medication to the individual and hopefully get better outcomes from that.
I've always known that I've got asthma. I was just told, oh, you've got to do this, you've got to do that. And as I got older, I didn't really know what it was meant to do, what it was for. It just seemed like a chore. The instructions are always quite confusing with my medicine because I get told different things, and it just makes you think if it was that important, I'd know everything about it. If I'd been informed how to take it correctly, I would have taken it like how you just brush your teeth, like a habit. Based on my experience, I really recommend the best thing for them to do is just pop to your local pharmacy. They're very informative, they can take you into a room and actually talk you through it, provide you with leaflets. They're really, really informative.
Information about medicines is changing all the time. It just illustrates that even if you've done something in a particular way for a period of time, that it's quite important to make sure that you've got the most up-to-date information, and the best way to do that is by regularly speaking to your pharmacist.
I've got a 2.5-year-old daughter, Lola. A few months ago, she'd been up all night, touching her ear, having the temperature. Took her to the doctors and they actually said it was an ear infection and gave me some antibiotics for it. The doctor said you can start the antibiotics today or you can wait and see if the ear infection goes naturally. I ended up asking the pharmacist when I actually picked it up whether I should, whether I shouldn't, and they were really helpful. They kind of sat down for about 10 minutes explaining more than the doctor did about the antibiotics. The actual instructions in the antibiotics weren't really so helpful because they're kind of applicable to so many different people, ages. There are lots of words that your everyday person won't necessarily understand. What I found really helpful was going to my local pharmacist, just because you're speaking to someone who can talk you through the medicine, actually explain when you can take it, when you can't take it, what other medicines you can take at the same time.
The NHS invests around £13.8 billion every year in medications. It's very important that patients take medicines correctly to avoid wastage, but also at the same time making sure that they get the best benefits and the best health. Pharmacists are the medicines experts. No other healthcare professional has more training on medicines. You don't need to make an appointment to see a pharmacist, and pharmacies are often open when other medical services wouldn't be available. For any concerns or questions that patients have, they are best placed to speak to the pharmacist first.